Welcome to Thrive on Plants, where we explore the science and the soul of plant based living. Today, we're diving into a conversation that's both timely and timeless, and one that I think every woman in midlife needs to hear. October is both Menopause Awareness Month, and this week marks Bone and Joint Health Action Week, leading up to World Osteoporosis Day on October 20th. Now, these observances aren't just dates on a calendar. I think of them as a call to action. Because here's the truth: the metabolic shifts, the muscle loss, the bone density changes, all of the things that accelerate during perimenopause and menopause, they're real, but they are not inevitable. You have far more control than I think you've been led to believe. Today, I'm joined by Dr. Brooke Bussard, a physician who traded in her white coat for an apron and her stethoscope for a dumbbell. Dr. Bussard is a graduate of the University of Virginia School of Medicine, a health coach, a personal trainer, a fitness nutrition specialist, and a food for life instructor. She's the author of the book Outsmarting Menopause: Conversations about Metabolism, Mood, Muscles, and More. And she's also the founder of Plants Over Animals and creator of the Quick Cooks app. What I love about my conversations with Dr. Bussard is the fact that she doesn't just understand the science, she lives it. She's walked the path from clinical medicine to lifestyle medicine, and she's navigated perimenopause using the very tools that she uses to educate her community. So, Dr. Bussard, welcome back to the Thrive on Plants podcast. So, Brooke, welcome back to the Thrive on Plants podcast. I really appreciate you coming back for yet another conversation with the community.
I'm happy to be here, Daphne.
Brooke, we went back and forth on a lot of different options for conversations today, but I would love to circle back to topics that we had started talking about last time and probably didn't have a opportunity to explore. And so would love to talk a little bit more about metabolism and muscle as they go together, and in particular, why midlife feels different. Because and I don't know if you see this with the clients that you coach, but many women are struggling with weight during this phase of life. They struggle with energy, they struggle with some sarcopenia or muscle loss, even though they haven't changed anything. Has this been your experience? And if so, can you help us understand what's really happening under the hood?
Definitely. It's right on point, and I think we have so many good, things to talk about today. Just in that intro that you, gave, I feel like we could dive into all the aspects of it for the next hour. But I do love your analogy of looking under the hood, because so often we hear about, "Oh, we've gotta put fuel in the tank and, keep the car running." But if we actually look at a cellular level at what's going on inside of our bodies, we can really start to understand more of why these changes are happening and know how to deal with them.
Mhm.
Because so often, um, you know, we 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 have sort of these, broad tenets that we're trying to cover everything with, and we're not getting down to the nuance. And if we look at the cellular level for females going through menopause, we have a very, very different situation than we did premenopausally or than men do. And um, and so what I'm really getting at is the fact that we have estrogen receptors on all of our cells. That's not something that I learned in medical school, or if I did, I slept through it. I'm not sure, but I was a pretty good student. So,
You're not alone.
okay. Um, so I think it's really important to understand that estrogen is not just a hormone of reproduction. It's not just a hormone that affects whether we have a menstrual cycle, whether we grow breasts, whether or not our hips widen. Um, Estrogen affects every cell in our body, and the effects on our blood vessels, our muscles, our bones, and that's what we can get into today, because that's really going to affect our metabolism and why everything starts to change once we lose our own production of estrogen.
No, Brooke, I did not learn this in medical school either. And in fact, I was just reflecting as I was thinking about our conversation today. I don't remember learning much after menses. Um, but you're right. The metabolic and hormonal milieu really dictates what's happening to our metabolism. Can you start? Let's talk about muscle first, because I know that that's something that I hear a lot of women, and I partly because what we're hearing in the on social media and in the lay press is that this is the year of muscle. Muscle is the organ of longevity. But why would estrogen or changes in estrogen affect our ability to gain or retain muscle? And why is it important for women as we go through midlife from both a metabolic and a musculoskeletal perspective to either retain or gain lean muscle? That's a redundant. To retain or gain skeletal muscle mass as they're going through midlife?
Yeah, I think, yeah, holding on to muscle and building new muscle, particularly if you weren't someone who did a lot of muscle building in your earlier years. Like, this is really important at this time of life because there's different ways that muscle grows. So, muscular hypertrophy, the growth of muscles, is dependent on many factors, but one of the key ones is happens when estrogen binds to the satellite cells in muscle that allow it to grow.
Mhm.
And there are plenty of other ways that this can happen, but estrogen is, really a good friend in that way. They make it super easy for us. So, knowing that, we can A, make a decision about whether or not we want to take some form of hormone therapy, which hasn't really been shown to do a whole lot as far as growing muscle. But I think, there's a lot of research yet to be done. So I don't think we can say definitively whether or not that's helpful or not helpful to what degree. Um, so but it's really important for us to remember that um, resistance training is the main stimulus. We have got to put in the work, and it doesn't have to be terribly hard, terribly long. We just need to create a stimulus for muscle to grow. Um, and as we age, we have a little more resistance to that growth. It's
Mhm.
called anabolic resistance, as you know, Daphne. Um, so we're resistant to the stimulus, so we need a little bit more of the stimulus, and we're also resistant to um, the stimulation of the muscle growing that happens when we consume protein, break it down into amino acids, and then they need to be reformulated into the muscle tissue. So, so age, one thing to talk about is the fact that as we're going through menopause, we're also aging.
Yes.
So these two things are so intertwined that we really can't separate them. We need to talk about them together. And men talk about it all the time about the aging process and losing muscle mass. And, they talk about replacing testosterone as a way to do it or, going to the gym more. Um, and so we need to be thinking really in the same way. We need to be making sure that we get our training in and we fuel ourselves appropriately with the right macronutrients
Mhm.
in order to give our body what it needs to get over whatever threshold it's currently at for stimulating muscle protein synthesis.
Mhm. And you brought up an interesting point because so, here we are where as we're going through perimenopause into menopause, there's one, the development of a weight loss resistance. So there's this tendency for some women to cut calories or not to fuel. But at the same time, we're advocating that you need to fuel your body in order to you're not gonna gain muscle if you're not feeding your body. Um,
Right.
it's the stimulus, as you said, of exercise, plus the nutrition, plus recovery and everything else. But if you're if you're living on 1,200 calories a day and you're at the gym twice a day, you're still not going to see a change. How do you reconcile what seems for some women to be a challenge between I wanna manage my weight, and I try to use body composition, so I'm trying to get away from the scale being the deterministic factor that we're managing, but I need to also feed my body so that I don't become catabolic and lose muscle.
Yeah, I think that is a very tricky situation, particularly for women who have been thin their whole
Mhm,
life, but they
mhm.
might be, uh, what we call normal weight obesity, you know? And they are really at an increased risk for a lot of chronic diseases because without the muscle mass and with too much body fat, you're more likely to become insulin resistant and then generate a lot of inflammation in the body. And, that leads to cardiovascular disease and cancer. And so it's really important to not underfuel
Yes.
because we can't grow muscle and we can't change the body composition. So I think probably the best thing I could say in that regard is that it's helpful if you can try to experiment and
Mhm,
see what are your maintenance calories.
mhm,
And I don't love food tracking. I think it's tedious and annoying. But I think it can be helpful at times just to give women a sense of what can my body consume and use. And we want them all to be, of course, good, healthy foods that you're putting in because that's what your body's going to want in order to build muscle and recomp the body. But try to figure out, what is a good maintenance intake for you, um, and then push hard in the gym, and you'll burn extra calories and lose some body fat and build some muscle. But if you just continue to calorie restrict like you've always done in order to stay thin and fit in your clothes, you're going to keep going in the wrong direction.
mhm.
Like you're going to continue to lose muscle. That muscle is going to be the muscle itself isn't really replaced by fat, like,
Mhm,
but you will put on fat.
mhm.
So you might maintain the same weight that you were, which you might think, oh, that's totally fine. But all of a sudden your clothes start not
Right,
fitting. Like
right.
fat takes up a lot more space than muscle does. And it's, got a lot of metabolic problems that go along with having excess body fat.
Mhm.
So I think, Daphne, that was a very long-winded answer, but I think the bottom line is that you've gotta figure out where your maintenance calories are and not try to restrict to the point where you can't change the body composition.
No, Brooke, I'm with you. I think too many women are underfed and
Mhm.
that we often see body composition changes when we replenish those nutrients, as opposed to continuing to restrict. But it's a mindset change, and it's a challenge because for so long, restriction worked. But to your point, we've developed anabolic resistance, we're probably having a little bit of insulin resistance. We may have insulin resistance, which contributes to maybe some additional adiposity, um, but continuing to restrict won't help any of those.
So true, and I've had the privilege of watching both of my high school boys go through weight gain and muscle building,
Uh-huh.
and I had a nice conversation with Robert Cheek about it also. The fact that you can't really put on muscle in an energy deficit, and you actually need to be in a little bit of a surplus. And so if you don't look as defined for a period of time while that transition is happening, that's totally normal. And I watched both of my boys do it and, gain a tremendous amount of muscle, but they went through an awkward phase in the middle. And I'm not saying that, we should try to do that, to that degree because we can't physically, we don't have that testosterone that they have. Um, but it was an interesting observation in my house over the course of several years that I witnessed day after day of them, eating a significant amount of food and watching this process happen. And it really gave me a new perspective on muscle building and
Uh-huh.
body recomposition, actually. Yeah.
And how much you can actually feed the body.
Oh, yeah, I often tell people my older son, I would send him to school every day with 4 peanut butter and jellies, and that was just, like, the extra food that he had in between, and he always said, like, he was never hungry, often ate when he, was already full, but he knew that he had to do this in order to, break through his,
Mhm.
uh, threshold of where he was just sitting and sitting and sitting for so long.
That 4 PBJs sound good about now. Um,
Oh.
but let's talk about bone because I was talking to a group last night, and one of the things I reminded them is that muscles are connected to bones, and I think we tend to forget about bone until something happens, or at least we don't talk about bone health in terms of prevention that I think we should, because probably another fact that I slept through in medical school was that we build most of our bone in our 20s and 30s, and that attaining that optimal peak is going to set you up for a much better outcome because the higher you go and as you're developing your optimal musculoskeletal strength, the slower that taper will be over time. So you won't cross the frailty line as early if you're up here than if you're down here. But how do you talk to what conversations do you like to have with women about their bone health? And what are you hearing in terms of questions or um, even I'd say misconceptions about how we need to maintain our bone health as we're going through menopause?
Oh, Daphne, okay, there's a lot there and so many good things, so many good questions. So, first of all, I think the biggest misconception is just consume as much calcium as possible and your bones will be strong.
Nope.
I tell you how many women in their 60s, 70s, 80s over the years that I would talk to that were saying, "Oh, yeah, I'm drinking 2 to 3 glasses of milk per day
Oh.
because that's what my endocrinologist told me to do." Um, yeah, so I think that's, like, one of the biggest misconceptions, and what I love to talk to women about that yeah, I'm with you, Daphne, I didn't hear this in med school either, is that muscle is attached to bone, and so there's 2 great ways that we can stimulate bone. One is we can tug on it,
Mhm.
so muscle attaches to the bone through the tendon, and when the muscle contracts, of course, the tendon pulls on the bone, and so that's a stimulus to those bone cells that say, "Grow, grow, grow." And when we're going through menopause, we've got bone building cells and cells that break down bone. So osteoblasts and osteoclasts, and they normally work in a nice balanced way, for many decades. And during those, first 30 to 40 years of life, some cells are building bones, some are breaking down the bone. And so our skeleton is constantly remodeling. It's not this static, stone structure that we get it from the beginning and we have it for life. So it's constantly remodeling. So in menopause, as we're going through this transition, we start to lose a whole lot of bone because the estrogen receptors on the bones don't have estrogen telling them what to do anymore. And I think of it as what some kids might do when their parents leave town. They just go crazy, they start having parties. And so I
Uh-huh.
think the osteoclasts that way, the ones that chew up the bone. So they're just going crazy, chewing up bone, and the osteoblasts can't keep up. they're not getting this signal to make new bone. So women can lose a tremendous amount of bone just in 5 to 10 years around menopause. And we can stimulate that bone again in two ways mechanically. One is to pull on the bone, and one is to push on the bone. And so pushing on the bone would be any sort of impact exercise, like jumping, hopping, skipping. And I think we'll talk a little bit about the LIFTMOR trial here in a minute, where one of the exercises that they used to stimulate bone and showed bone growth in postmenopausal women, they had them jump up into a chin up and then release and land as hard as they could on the ground. And a lot of women are afraid to do that. They're told, oh, you're so frail, you might break something, like, don't do those sorts of things. And it turns out Belinda Beck and her colleagues showed that actually, if you do them, they actually make things better.
Exactly.
Yeah.
Before we dig into the lift more, I wanna go back to your calcium. I'm taking some notes because there's so
Okay.
many things we could talk about. So, I remember probably 10 or 15 years ago, I being one of those people who I would go get my Viactive, and I would take my calcium supplement. Are you saying that women don't need calcium as a supplement anymore, or that we should mainly be getting our calcium from our whole foods, and we don't need to be supplementing?
Yeah. So we still need calcium, but we want to get it from our diet. And it's actually not recommended to take it as a supplement anymore, which is always so interesting, right? When we were told something and then they pull it back on us. Um, but I think it can be dangerous for several reasons. If calcium builds up in plaques in the
Mhm,
arteries,
mhm.
if for some people it might increase their risk of stones, kidney stones. Um, so, so we want to get it from our diet. Still, probably the recommendation is 1,000 to 1,200 milligrams per day in a postmenopausal women. Um, but in other countries, it's actually less. So, I'm not actually married to the 1,000 to 1,200 milligrams.
Mhm.
I think if somebody is getting, so I think in the UK, it's 600 or 700 milligrams is the recommendation. In some other countries, I think it's 800 milligrams. So I think we also need to remember that it's not just calcium, it's phosphorus and magnesium and other minerals that help build the matrix of the bone and contribute to bone density. And I guess that's another point, is that when we're evaluating bone health, most people are just getting a DEXA scan, which looks at how many minerals are there per unit area in the hip or the spine. But there are other tests now that are not widely used, but they exist. They have a research center at Hopkins here in Baltimore where they use the DEXA scan with the TBS score. So there's software that you attach to the machine that gives you a trabecular bone score. So it gives you more of a sense of what does that architecture of the bone look like? Like, is the lattice well put together, as opposed to just having a lot of minerals in there? It's like, what is the actual structure? Um, and so that gives another picture into bone health. So I think that there's just a lot more to consider than calcium. It's important to get calcium and all the other I mean, we need calcium to make our, you know, heart contract and our
Mhm.
muscles contract. It's not Calcium is not just a mineral for bones. But we have so many other nutrients that we need also.
Calcium, magnesium, boron, you're correct. It's not just calcium. And so to summarize that calcium, you can meet your calcium needs no matter what country you're listening to this from by mainly consuming whole plant foods. Um, and if whether you're shooting for 600 milligrams a day or 1200 milligrams a day, your leafy greens, all of the things, if you may have some enriched foods that may have added calcium to them, but for the most part, a whole food plant-based diet predominantly plants, can meet your dietary requirements for calcium intake to support healthy musculoskeletal health.
I love that summary, Daphne. And I will say that I eat a lot of beans, and
Mhm.
beans are a great source of calcium also for
Beans and greens.
yeah. Mhm.
And before we talk about Dr. Beck's study, I actually had put REMS on our notes. So let's open up the door a little bit on how we assess our bone health. Because number one, I'd love to get your thoughts on when is the optimal time to look at your bone health? Because when I look at graphs of age versus mainly bone mineral density today, and I see it goes up and then starts to come down, I'm thinking maybe I should have known what my peak was. So I know whether I'm starting from a little bit of a deficit. Um, but if I'm waiting until I get my healthcare plan dictated assessment, I'm going to be 65. So question one, what are your thoughts on timing for getting a baseline to assess bone health, mainly as measured by bone mineral density? And then when we're thinking about these other components of bone health, so mineralization is important, but I don't think people realize that that lattice work, that trabecular structure, is also something that's important, but it's not something we talk about, and it probably isn't something that we routinely assess as part of a
Totally.
general picture for bone health.
Yeah. Yeah, I don't think it's widely available.
Mhm,
So I think it's important to know about so that you can consider other ways to
mhm,
train your body in order to make the structure better, but you
mhm.
might not know the actual score.
Yeah.
But let's go back to when would be a great time to find out your bone density? I actually think I have never heard that question before. So I had fun tossing around an answer in my head, and I feel like 30 is a great number.
Mhm,
I feel like if women at the age of 30, the same way, you get your colonoscopy at 50 or, some other number based on family history. Um, if at 30 women could get a bone density, a DEXA scan, find out
mhm.
their bone density, um, that would be great because then there's still plenty of time to continue to, you know, build a little bit more bone. Maybe 25. I don't know. I feel like at 25, you might be so young that you're thinking, I don't really need to do that.
Uh-huh.
I don't know. So, but 30 sometimes I think is stated as the sort of peak bone mass,
Mhm,
but I'm not sure that it actually is now that we see that we can actually grow bone if we stimulate it the right way.
mhm.
So somewhere between 25 and 30 would be my answer. Is that what you're
Okay.
thinking, Daphne, or what was your answer?
No, I would agree with you.
Okay.
Partly because and it'd be interesting, to get some experts to weigh in on this. One, I see more young ladies who have had a challenging relationship with food in their teens,
Mm.
which one kind of impact their menses. So maybe they're not having as much estrogen stimulation of, you know, calcifying the bones and making sure that trabecular structure is strong. So knowing our societal focus on being small, and knowing that there are many women, many young women who maybe underfed themselves for years, I also worry that they undermineralized themselves for years. And
Absolutely. Yeah, so
so that
maybe there's a caveat of, like, 30 unless you fit these criteria, and then it's, you
s
know,
earlier.
sooner, yeah.
Yeah. But 30, I agree. Knowing where 30 would be a good point because you're maybe at your almost peak. For women who are going into childbearing years, know that some of the calcium that your baby needs as it's developing is coming from you.
Mhm.
So you also have a baseline there. But waiting till 65 to me,
That is way too late.
yeah,
Way too late, yeah.
okay, it's time to start lobbying the healthcare plans.
Totally,
Um,
totally, yeah. Okay, so what did you have another question in that question?
uh, I think you touched on it, which is
Okay.
that, looking at so people probably don't think about the fact that your bones also have a tensile strength and that there's a little bit of bend in them even when we're moving. And that's partly what you're talking about for this other component of bone health that we don't consistently measure yet. Um, but I'm seeing more and more conversations about it. So what you're seeing at Hopkins may start to become more standard practice over time.
Yeah, I think, yeah, so I'm gonna go back to your original analogy of looking under the hood. So, there are these channels that exist between the cells of the bone in the structure of the bone, and these channels go side to side, and they're at different angles, and when that fluid is moving around based on your activity, it's, again, a stimulus for those bone cells to build. So, so knowing that, again, knowing what's under the hood allows us to tailor our activities to make that fluid move in those directions in order to stimulate the bone for growth. So people who play tennis and pickleball and they do these lateral motions, they could get more stimulation than somebody who's just running straight ahead.
Right.
Yeah. So just having in your mind that moving in different directions um, and using different planes of motion will be beneficial.
And that's a great segue into talking about the LIFTMOR studies, because I'd love to partly go back to what you were talking about earlier, because I hear this frequently too, where maybe it's, a woman my age, a little older, who maybe has some osteopenia or has developed frank osteoporosis and comes into the program saying, well, my doctor told me I can't lift because I'll just leave it there.
Right.
And trying to have those conversations and not to contradict what their healthcare team was saying, but to help educate and make clear that we can continue to build new bone, even if we do carry a diagnosis of low bone mass or osteoporosis. As you were writing Outsmarting Menopause and trying to put together a framework for the conversations around bone health, how did you interpret the LIFTMOR studies where they're encouraging women to do some of that vertical loading, some heavy lifting? Uh, I'll leave it there. Then we can talk more about some of the dynamic out of, transplanar movement, which needs to be incorporated into a really healthy and holistic training program.
Yeah, and it's interesting that in Belinda Beck's study, like she didn't even have that in there. I mean, it was 8 months, I
Mm,
believe, of three resistance training exercises and then the jump exercise, if I remember correctly.
mhm.
So I mean, it's amazing. She had people who had both low bone mass, osteopenia, and osteoporosis, and had phenomenal results. The fact that they all gained bone density, and the control group was in the negative. They continued to lose bone mass. So if we don't do this, it's not that we're just going to stay still.
Mhm.
We're going to continue to have loss. So, so I think, as we think about our training, a lot of people have never trained before. So just jumping right into what's in this study is not realistic and it's not recommended by any stretch. But she had people doing, 85% of their one rep max in what the deadlift. I think I've got this study over here. Uh, did she do deadlift, squats, overhead presses?
Yep.
Yeah. Okay. And um, yeah, they did low reps for, multiple sets.
Mhm.
And um, yeah, I think it was a landmark study that really was able to show people you don't have to walk around worried about your bones if you get a DEXA scan that's lower than normal.
Mhm.
Yeah.
And another question I think I'd love to hear your thoughts on, and I had this question last night too, which is what is heavy? So when we read 85% of one rep max, or when we read lift heavy, how do you have that conversation with women? Because I think that can be scary because heavy for one woman is different than heavy for another woman. But how do we make women feel comfortable with understanding, one, that they can probably lift heavier than they think, but two, taking that first step and just starting?
Yeah, so I think if we described it a little bit better, I think by saying 85% of our 1 rep max, that's pretty intimidating. Like, that's like, what is
Right.
that? Like, that's it seems, like, scary. But really all we're trying to achieve there is we're trying to use a weight that's heavy enough that by a few reps,
Mhm.
we're pretty darn exhausted. And that stimulates the muscle in a different way. And by stimulating the muscle, we're tugging on that tendon that's tugging on the bone, sending a message to the bone to get stronger. So the muscle's getting stronger, the bone's getting stronger. We're doing sarcopenia and osteopenia at the same time. We're dealing
Mhm.
with low muscle and low bone and making them stronger. So, so when we use that term, 85% of our 1 rep max, it's just a way of saying we want to lift something heavy enough that by 4 or 5 reps, we're ready to put it down. We're hitting fatigue. And a lot of times I use the term of 2 reps in reserve where you
Mhm.
could probably squeeze 2 more reps out, but you don't really want to, and your form might deteriorate a little bit. And we don't want to do that because we don't want to risk injury. But say we have somebody who has never lifted before and we want to get them started, I wouldn't use any of those terms. I would say, first, what we're going to do is we are going to work on your movement patterns.
Mhm.
We're going to work on squatting, hinging, lunging, pushing, and pulling.
Mhm.
And we're going to do those just using your body and probably a resistance band for pushing and pulling.
Mhm.
So we might start with a sit to stand. So we've got our chair, and we're just going to sit and stand, just like it says. And then we're going to say, okay, I'm not actually going to transfer my weight into the chair. I'm just going to tap it with my rear end.
Mhm.
And then I'm going to take the chair away, and I'm just going to do a squat. And so then I'm going to feel good enough with my squat. My form's going to look good enough that Brooke's going to hand me a dumbbell. And the dumbbell might be 5 pounds. And I'll say, "How many of those do you think you could do?" "Oh, I could probably do 12 of those." Well, if you're doing 12 of those, then you were at, I don't quite know the number off the top, but maybe you're at 60% of your 1 rep max or 50%. But see how, like, the number of the percent of your 1 rep max is coming down
Mhm.
because you could probably do a lot more weight than that one time, just to help everybody understand what we're talking about. Um, so then once somebody feels comfortable with the weight, then I say, okay, well, let's increase the weight and take you down more into the 8 to 10 rep range. Feel comfortable with that. Now we're going to start to get into the 6 to 8
Mhm.
and then down toward, 5 to 6. So I think if you use a very stepwise, methodological approach, then you can take the intimidation factor out of there and know that it's not a race. This is going to occur over the course of many months, and you're going to get there. But you just have to work through the steps in order to feel comfortable with the process. Is that helpful?
No, that's very helpful,
Okay.
because and I love that you started with, "Let's just start with your body weight and make sure that you're moving your body in a safe way with good form," because that's the foundation for everything, and I don't think people realize that they're going through these movements every day already.
Mm-hmm.
It's just, sitting down to a chair, you just did the sit to stand test 30 times. Okay, now we can progress that movement. I love that you made it accessible to everyone because you don't have to go to a gym to do resistance training. You can train at home, you can train on vacation, you can train on the beach. There are very few obstacles because your body can be one of your biggest loads that you can carry around with you everywhere.
Yeah, and I think people don't realize until, I'm talking to them and they're like, "Oh, Brooke, I've gotten to the top of the dumbbells that I have in my house." I said, "Oh, well, that's okay. We can just change the tempo."
Tempo, yeah.
Right? Yeah, there's other variables that we can work with to make it harder so that you don't have to pick up more weight, because it might be that you're maxed out on your grip strength for what you can actually hold. And so we need to have other variables that we can work with in order to change the intensity.
And what you're getting at is progressive overload. So they may have maxed out on their dumbbells, but for you to continue to load them, let's move you differently. Concentric, change the tempo, eccentric, change the tempo. Um, you can still work within the confines of what you have and find a way to continue to challenge your body.
Absolutely.
I know we didn't talk about this before, but as you were talking about hitting the limit of what you have at home, I am getting so many ads in my feed for weighted vest. Uh, what are your thoughts on weighted vest in this conversation related to sarcopenia and osteopenia?
So I don't have a weighted vest. I've tried one once and I think it was overloaded for what I should have used. I was visiting a friend down in St. Petersburg and we went out for a walk and I put one on that was quite heavy and was sort of just aching all through my torso. Um, but, from hearing clients who have them, um, who use them to add weight when they're doing their squats or, resistance training exercises, I think that's a very interesting use
Mhm.
for the weighted vest. Again, like if you don't have enough dumbbells or you're maxed out on what you could hold on a goblet squat or something like that, they could be helpful. Um, and I haven't really found a lot of data yet about how, if there's any injury risk in long-term use in using a weighted vest, um, particularly because the female body, our center of gravity is lower than in men.
Mhm.
And so we're wearing a weighted vest the same way a man would wear a weighted vest. And I've heard some of the experts talk about how we need our weighted vest to actually be like a weighted hip belt.
Hip belt, yeah.
Yeah, because of our biomechanics and, our Q angle and, all of this sort of thing. If you're gonna use a weighted vest for long walks, it might be better if we could get the weight a little bit lower on our
Mhm.
body. But I think there's so many and I've also heard for women who have, a lot of, breast tissue, like, they can be quite a challenge, as far as,
Discomfort.
like, how you wear them, yeah. Um, so I think we have a little ways to go on the weighted vest. I think there is some research that it helps with bone in your spine.
Mhm.
But again, like I haven't felt comfortable enough with the data yet.
Thank you.
How
Uh,
about you?
um,
I feel like I see you with a weighted vest on social.
I do. I've had a weighted vest for years. I started The first weighted vest I ever purchased, I actually purchased for my dad. And, so when he was alive and I was trying to get him moving, I wanted to provide some additional load, but leave his hands free. So that
Right.
way, if he needed to fall or if he needed to catch himself, that because I used to see people with dumbbells in their hands walking, and I'm like,
Mhm.
that to me just looks like a recipe for disaster. So I bought him a weighted vest, and then I also got a weighted vest so that way we could walk together. I have so I've been using weighted vest as just an accessory for adding some additional load for squats, push-ups, for walks. I've been doing that for probably 10 years. I think
Oh,
uh, m
wow.
maybe 9, 10 years ago. Um, and then when I was recovering from my injury, all I had at home was a weighted vest. And so but I used it as not only as a weight for vest, but I used it to do dumbbell curls, I used it to do presses, I used it to do one-arm rows. So it became my dumbbell because I that was all I had. I but I agree with you. I think that there are benefits to weighted vests if used appropriately, if sized appropriately, if fitted appropriately. Um, I don't think they're a panacea, and I don't think they're a replacement for structured resistance training. I think, and that's where I worry there could be a misinterpretation of some of the information on social media. It
Mhm.
it's meant to like I've been looking at the Amorpho vest, which looks beautiful, and it's just 5 pounds, and it's meant to add some additional resistance, but it's not the same as picking up 2 30-pound dumbbells.
Yeah, I think you just said something that reminded me. I lost my train of thought.
Oh,
Okay.
sorry.
No, you had so many good things going on there, and I was like, "Oh, there's something," and then I lost it. Yeah. But I do think women have different body shapes, and I think that probably
Yeah,
is gonna play a role in it. Oh, I know what I was gonna say. Um, if a weighted vest gets you out walking, I think then it's
100%.
valuable. Yeah.
100%.
Because I think for some women, they if they have a weighted vest and they feel like, "Oh, I need to put that thing on and go out and walk," like, "I've made this investment and now I need to walk,"
Use it.
as opposed to, "Oh, I was gonna walk today, but I don't really feel like it," or, "I'd rather go over and, see if there's anything new at, you know, some fitness store," whatever it is. Um, yeah, I think it could be just a helpful tool to get you out the door.
Yep. And for those of you that have a weighted vest, you can use it on your walking pad. So if you're walking at home or if you're walking on the treadmill while you're watching Netflix or watching television, you don't have to just use it outside. You can also use it while you're doing your walking in the home. All right. I would love to turn your thoughts to data.
Okay.
We talked a little bit about DEXA scans, and we also talked about trabecular bone scores. Uh, I know that some of that may feel a little bit in the weeds for some of our audience, but what do you think? How do you incorporate some of these smart trackers into your coaching today? Going back to both metabolic health, not just bone health. Um, but there's so many smart devices. What Whoop just announced Whoop Advanced Lab, and I'm a Whooper. I'm tripling today. Um, but where does data fit in the spectrum for you for women understanding their menopause journey?
So this is so interesting, Daphne, because you're like a triple whooper, and I'm over here and I have freed myself of all data collection.
Oh, interesting.
Yeah. Um, I think I think we can get so wrapped up in all of the things around menopause
Mhm,
that we forget to live our life.
mhm,
And if you're someone who is constantly checking the data, worried about the data, wanting the data to be different, it might not be a good idea to wear anything that collects data. Um, but I think if you're somebody who thrives off of data, like then they're great. The only
100%.
thing I would warn is that I'm not sure the data is always correct. And so it's important to remember that how you feel is the most important thing. Again, I saw my older son go through this when he first got to college. He plays baseball, and the team put whoops on everybody.
Mhm.
And um, I would say, "Oh, how's your data look?" And he goes, "I don't look at it. they collect it, but I don't look at it. I don't do anything differently based on it because there's days when I wake up and I feel great and it says I slept terribly. I had terrible sleep and I need to pitch tonight.
Uh-huh.
And it's going to affect how I pitch if I think that I didn't sleep well, even though I feel great. It's going to affect me when I go to try to strike somebody out. And I was like, "Oh my god, that's so insightful of you, first of all." Um, and then I extrapolated that into, like, real life. Like, how am I gonna behave differently in my day if I see some data that says, I only got, a half hour and, REM sleep last night. All day I'm gonna be thinking, "Oh my god, I gotta get to bed early." I'm, like, rushing around, you know, trying to, like, protect tonight's sleep based on something that was generated, and I'm not even sure it's totally accurate. Maybe, the accuracy of these things probably is probably very well studied, but on an N of 1, like, I don't really know, right? So, so that's sort of how I feel about, you know, wearables.
Uh-huh.
Now, I do think it's important to track body composition. So I think if everyone could get the kind of DEXA that does body composition.
Mhm.
So when people think about DEXAs, it's important to know that there's the DEXA that you get for your bone density, where they look at hip, spine, and sometimes wrist.
Yeah.
It's very specific. And then there's a DEXA scan where they do body composition. They look at how much fat-free mass you have, how much, which is your bone and your muscle and your organs, and then how much fat mass do you have? Your
Mhm.
subcutaneous fat, your visceral fat, like that. I think if somebody could get that done once a year and sort of just know which direction they're headed in and how their training's going. And if you're new to training and you're going to have um, more rapid results, maybe get it every 6 months.
Right.
Um, they're so much more reliable than bioimpedance methods, which
Mhm.
would be like an in-body scan or, some of the scales that you buy for home use.
Mhm.
Yeah. So I think, um, of all of the things, I would think that a body composition through DEXA would be the one thing that I would really recommend for people.
And how do we get that to be part of standard healthcare? Because right
That
now,
would be
like,
great.
I agree with you, but it's not covered, it's out of pocket for most people, um, which is great if you have the means, but for those of us that rely on our health insurance to determine what screening exams we get, Dex is not even in the mix right now.
Yeah, but I would say, DEXA is definitely less expensive than wearables, you know? And I think it's more valuable.
Mhm.
Now, but if you're somebody who on a day-to-day basis thrives on the data and like, "Oh, I need more strain today, I better get going," that sort of thing, then it's gonna be a toss-up, right? Um, but yeah, if everyone could get insurance to cover it and their, primary care provider would say once a year, when you get your lab work done, you also get this body composition, that would be phenomenal. Yeah, so they're about 180 bucks in our area to get them done. But I tell people, so I've got a client who recently she signed on with me a couple months ago, and recently we were talking about doing our body composition, and she didn't have a scanner within an hour and a half of her.
Oh.
Yeah, it was bad. So, honestly, though, my second choice for body composition is the mirror and your clothes. I think they tell us a lot.
Mhm.
Um, it's nice to have hard data, but if you don't have hard data, like, you usually know when your body composition has changed. Yeah.
No, I think the tape measure, you're right. Your clothes, a dollar store tape measure
Mhm.
to look at your waist and your hips, which are a great proxy to understanding what your body composition is.
Mhm.
And even, and I don't, I mean, I know Some practices are actually doing waist measurements, not all. So I think that there's opportunity from a lifestyle medicine perspective for us to advocate more strongly for some of these, whether it's low tech options, track your waist and your hips, medium tech options, maybe have a bioimpedance scale in the office, or higher tech options, maybe the health plan covers a body composition DEXA. And in my mind, that would pay off because if you can see someone who has normal weight obesity, has a high visceral fat early, and you can prevent or mitigate some development of prediabetes, type 2 diabetes, that scan paid for itself. Um, I mean, a couple months of metformin or a couple months of a GLP-1,
Totally.
1 month of a GLP-1, um, far outweigh, I mean, $180 versus $1,000.
Right.
We've covered a lot. Um, is there anything in particular about bone and musculoskeletal health? And again, I want to encourage people to read the book because it is a very accessible overview of what we need to be thinking about as women going through midlife. But is there anything we didn't touch on before I ask you some rapid fire questions?
I think the only thing is fall prevention. So,
Oh, yes,
yeah, I
important.
think it's really important when we talk about bone health to include,
Yeah.
balance and
Yes.
make sure that people are in touch with, balance exercises, knowing, if certain substances impair their balance. I recently had a situation where, somebody fell after an evening of drinking.
Mhm.
Um, so alcohol was gonna impair your balance. So it's really important to be able to work on some things and just check in with yourself periodically. If you're like, "Oh, my balance is pretty good," just check in periodically. Like, "How do I do on a one-legged stand?
I
Can
was
I
just gonna
walk?"
ask you. Yeah.
Yeah, "Can I walk in a straight line, heel to toe?" Um, you know, can I do I like to try doing, an inverted flyer. So it's like a single leg RDL with no weights,
Mhm.
essentially. Yeah. And I think I even have pictures in the book of the balance exercises where the friends are texting each other about them. But check in with yourself and see how you're doing with your balance because I think it's important to know.
So if I can't stand on one leg and brush my teeth, do I should I be working on my balance?
Yes.
And what what do balance exercises how do I do that? Is it are there specific exercises? Is it a special program I have to follow?
Very simple. No, a lot of times you could be standing at the microwave on one leg. You can be standing in the line at the grocery store
Mhm,
and, stand on one leg. But it's also good to do um, some that are a little more mobile, like the one-legged, inverted flyer exercise where you're on one leg and you lift the other leg behind you.
mhm.
And all of those things sort of translate into real life. If you think about, okay, I'm walking down the street and I step on the curb a little bit too much and I've got to recover real quick, those sorts of things. Um, and it's actually quite helpful. People after you don't do them. I mean, it takes 5 minutes a day at the most. Yeah. And a lot of times you don't even need to do them every day, just a couple days a week, just to sort of get your body and your brain remembering what it's like to balance. It's like with everything else, it's just practice.
And with your eyes open and closed, because that definitely is different when
That is
you
different.
remove the visual stimulus. Yeah.
Yes.
And Brooke, thank you, because I think one thing I forgot to talk about at the outset of our conversation is the why. We don't want so musculoskeletal health and the fact that we're talking about upcoming World Osteoporosis Day, we don't want women to break a bone. We don't want men to break a bone. We don't want anyone to break a bone because the morbidity and mortality associated with a hip fracture, a wrist fracture, a spine fracture, it's significant. And it's a combination of making sure that you're feeding your body nutritious, healthy foods, that you're moving on a consistent basis, and consistency is key, including incorporating the core strengthening, your balance. Um, all of those need to be part of a well-rounded training program. And then all of the recovery things that we always talk about too, getting your sleep, managing your stress, avoiding risky substances, because you may feel great, but if you have that glass of wine and you're walking around on your stilettos, does that put you at risk for possibly having a fall and having an outcome that you would rather not have?
Absolutely.
And I hope whatever fall you experienced in your family was okay.
Yes, yes. Yeah, he
Like,
is. He's doing all right now.
all right. I will not keep you, but I've got a couple lightning round questions if you still have time.
Absolutely.
Okay. Um, what is one morning ritual that you can't live without?
A soy latte with roasted dandelion root. So, I stopped drinking
Oh,
coffee during
mhm.
menopause. I got the, classic headache situation going, and I switched to dandelion root, and I love it.
Awesome. Where do you get that from?
I order it. There's a company called Dandy Blend.
Uh-huh.
Yeah, yeah, I think Tiki Barber is one of their spokespeople. I don't know if you know Tiki Barber. He went to UVA, while I was there. He's a football player, was in the NFL.
That's why the name's
Yeah,
familiar.
okay,
Okay.
yeah. He's an announcer now. Yeah.
And dandelion's also a good diuretic. So,
Oh, I did not know that part.
what is your favorite plant powered meal for bone and muscle strength?
1 cup of heirloom beans. So usually I like either a scarlet runner or there's a bean called Royal Corona. Sometimes I say Royal Corona and people think I'm talking about beer, but so a cup of heirloom beans and a cup of quinoa. And then
Uh-huh.
I like to dice up some cucumber and red onion and then
Oh.
squeeze a little lemon on top.
Is this on your website?
No, I started making this for breakfast at the beginning of
Oh.
October. Um, And so I have a campaign that's just my campaign in my head. It's called Beans for Breakfast, and I'm loving it.
Dr. Greger would love to hear that. Favorite breakfast are awesome.
Yeah,
Ah, what's one myth you wish every woman would stop believing?
that smaller is better.
I'm with you. Yeah.
Yeah, stronger is better.
Strong, not small.
Mhm.
And final question, how do you define thriving through menopause?
Thriving through menopause is really being able to do the things that you enjoy, but you continue to challenge yourself and really soak in life with a strong body and a strong mind.
I love that.
Mm.
Brooke, thank you. Thank you for your time. Thank you for this rambling conversation. As usual, I was here, there, and everywhere.
Oh, I think you were right on. Yeah.
But I hope that all of you listening are once again, I want to remind you about the book because it is such a wonderful read. And I'll put links to your website and to your app in the show notes. But thank you for celebrating Menopause Awareness Month and World Osteoporosis Day with me. And I can't wait to have you back on the podcast sometime in the future.
Yeah, Daphne, it was my pleasure. I really enjoyed this conversation. So thanks for having me back on.
And Brooke, before I let you go, I know in the past you've been a great sponsor and advocate for Breast Cancer Awareness Month. Um, is there anything you're doing this year that you wanted to share with the community? Or did I miss it because it's already the 15th?
Oh, yeah, no, I'm not doing anything specific. I'm just supporting Dr. Christy Funk and the Let's Beat Breast Cancer campaign with the Physicians Committee for Responsible Medicine, but I don't have my own rally this year. There's got
Gotcha.
a couple other instructors in Baltimore who had rallies. So, yeah, I think they're doing a great job. I think we've got 66 rallies all over the country this
Awesome.
year.
That's amazing.
Yeah, so,
And anything you have coming up for Diabetes Awareness Month?
uh, not specifically yet. Yes.
Okay,
Mhm.
then we will stay tuned.
Okay.
Thanks so much.
All right. Thanks so much, Daphne.
Take care. Thank you for joining me today. I hope this episode resonated with you. And here's what I want you to do. First, share it with a friend who's navigating perimenopause or menopause, because no woman should be alone or feel confused during this transition. Second, I want you to join the Thrive on Plants community. You can go to thriveonplantslife.com, and there we are having conversations on all of the topics we discussed today. Finally, I want you to ask questions. I want you to connect with other women. I want you to understand that you too can rewrite your midlife narrative. Also, remember, this is Bone and Joint Health Action Week, leading up to World Osteoporosis Day on October 20th. What a better time to lift something heavy, eat something green, and remind yourself you are adapting and you have more power than you know. So, until the next episode, please keep thriving on plants and living with purpose. Take care, and I'll see you soon. Bye-bye. The information shared on the Thrive on Plants podcast is intended solely for educational and informational purposes. It is not medical advice, and it should never be used as a substitute for personalized guidance from a qualified healthcare professional. Always consult with your physician or healthcare provider before making any changes to your nutrition, exercise routine, supplement use, or your overall wellness plan. The opinions and advice shared by our guests are their own and do not necessarily reflect the views of the Vegan Gym or its team. While we aim to bring you high-quality, thoughtful conversations, these perspectives are not intended to replace professional medical care. Thanks for tuning in, and remember, you have the power to thrive on plants and live with purpose.